Welcome to How Preschool Teachers Do It.
This is Alison Kentos. I am an early childhood educator.
And this is Cindy Tarabush. I am an early childhood consultant.
This podcast is for parents and early childhood professionals.
Let our experience and research-based knowledge become your guide. Hi, preschool peeps.
Hi, peeps.
So we are back with an episode related to behavior. Those are some of our most popular episodes. And we know that you wait for them. Some people have told me they wait for them. So here we are.
Yeah.
This, though, is going to focus more maybe on the adults' behavior than it is the children when there is a behavioral challenge when you're raising or working with children. This is more about what we do. And it addresses a frequently asked question that I get from people of all experience levels, ages. It doesn't even matter. It could be my college students, could be people who've been working in the field for a long, long time, people in all different positions. I'll get this question. And the question is, what happened to punishment? That worked when I was young. How come we don't do any of that anymore? And
it's so surprising that people still ask that because, we were punished when we were children, but I'm not remembering that being a great experience. Why would we want other people to experience that? But that's just me. I don't know.
I don't know. I mean, I think we're not going to enjoy the experience whether we punish or not because we've done something that now needs to be addressed. But still, I mean, there's lots of studies out in the world that talk about how punishment only works in the short term and that it gives children long-term negative effects. And when you really think about that, I want to compare it to something people can sort of relate to. Behavior. When children exhibit challenging behavior, it's a symptom of something that's more deep-rooted. It's sort of like when you have a symptom of something, if we were to only treat the symptom and never get to the root cause, those symptoms will keep coming back.
Right. Because you need to treat the underlying cause of the symptom, not just the symptom. Like you might feel a little better for a little while there because you treated the symptom, but the problem is still going to keep coming back, right? Like if you have a runny nose, you only treat the runny nose, but it's a deep-rooted sinus infection. It's going to keep coming back. The issue still remains. You might feel better in the short term, but the issue still remains.
Right. So it will keep coming back. Yeah. You know what it reminds me of? So when I was young, when I was a very young person, I used to get a lot of throat infections. I had my tonsils taken out when I was about 4, which was the thing to do when I was young. You have a sore throat, we're taking your tonsils out. They took them out. Yeah. It's not like today, right? Yeah. So they took them out all the time. But I still was somebody who was pretty prone to issues with the throat when I was young. I outgrew it. But I remember these infections and they would give you at that time, I don't think they still do, but at that time they would give you something to sort of rinse with. And what it did was it numbed your throat, but it didn't get rid of the infection.
Yes. It just makes you feel better. Right. It's like the spray, like if you have my mother still says, you need to spray your throat. Well, no, but if it's infected, that's just going to numb it. And then, I won't feel it. That's cool. I won't feel pain. But when the numbness wears off, my throat is still hurting. There's still something there. Yeah. So you need to treat like either this infection or whatever so that fully goes away, not just treat the symptoms so you feel good for a couple hours.
And there's a metaphor here to behavior.
Yeah.
There's a metaphor. Children exhibit challenging behavior because, and we've said this so many times, because there's something they need. There's a deeper cause. So what happened to punishment was we discovered that it was like the spray that would numb your throat, or it's like the nasal spray that may get rid of your congestion for a little while, but it comes right back because you have something else wrong with your sinuses, and the sinus issue needs to be addressed. It's sort of like that. When I've gotten to the point now, Alison, where when people say to me, whatever happened to punishment? I say, well, it was sort of like this, and I'll relate it to that sort of situation. It's sort of like putting a numbing cream on your infection, but the infection still exists. And so we have to get to, why do we have this infection, and how do we get rid of that? Behavior, we have to look at, why do we have this need, and how do we eliminate the need? How do we fill that need?
How do
you eliminate a child's need by fulfilling it, right? I'm going to fill the need. I'm going to do what this child needs me to do. Right. There was something you just said where I thought, oh, and I thought of a point, and now it's gone. And I'm going to be so sad when I re-listen to this. And I think the same thing. Just saying.
Yeah. Or it'll come to you later on. Maybe.
Yeah, thank you. Maybe. Maybe no, you never know. Your memory isn't so good when you're young, and it's not so great at my age either.
And you're asking like what I just said, and I don't even remember what I just said. So
there you have it, folks.
I can't even like recap for you because I'm like, I don't remember. And I said it.
There you have it.
So, see, symptoms of maybe bigger problems that we have. See, symptoms. I need to work on my memory. It still amazes me,
getting back to the actual topic.
Yeah.
It's not our memory, believe it or not. It still amazes me when I'm talking with people and I say to them, what does it mean? What does the word discipline mean? And they'll name punishments. In the year 2022, this still amazes me that this is what we think. Yeah. No, keeping that child from going outside or having that cupcake or anything that's unrelated to what actually happened and isn't a logical consequence. No, that's like the nasal spray, the throat spray, the numbing agent. That's what it's like. You've numbed it, but you've not cured it. And
I wouldn't even know
it takes time.
Yeah, I wouldn't even know if holding a child in from outdoor time is numbing it. I think that's causing the problem to get worse. I think that's going to inflame the problem, really, because I think now that child, with whatever need he or she has, now also is just angry, because you're taking away something that they need for their development. You're causing another issue. You're causing more issues on top. You're compiling these symptoms. Rather like, so yeah, it might make you as an adult feel better. Like, hey, look, I punished or disciplined them, and thinking that's solving the problem. Really, I think you just threw gas on a fire there. You're making that problem worse, and you're really not helping that child. You gave him more issues that you have to deal with and more needs that you need to fill, instead of filling the original need.
Right. If we were to think of these challenging behaviors, the physical aggression, biting, that sort of thing, right? All of the challenging behaviors that children exhibit.
Yeah.
If we were to think of them as a symptom, I think that could help to make us more empathetic and compassionate. And when you look at children, you think that's a symptom of a deeper problem. I think it changes our feelings about it.
It does.
Right?
Well, it makes you become more of a problem solver rather than let me just punish and discipline because that'll work. I think it makes you start thinking like, okay, this child is biting, it makes you start thinking of like, how can I get to the root cause of this problem? What is this cause? Like, maybe I should observe this child for a little while and see what leads up to the biting, rather than just be like, oh, you bit, let me put you in timeout, and that child has no idea that they are in timeout probably for biting, they don't, I feel like maybe you would start.
We've talked about this. They just get mad in timeout.
They just get mad. You're, again, adding fuel to a fire when you really need to figure out what the root cause is. And I do get like sometimes trying to figure out what that root cause is takes a lot of work as a teacher. It's a lot of observation and trying to predict when it's going to happen and watching that child. And I know you got a lot of work to do, on top of just that, but if you can figure out and solve that problem for that child, which would also solve the problem for the other children, because then now they're not getting bit if that's the problem or whatever, and you're also helping that family, then that extra work is going to pay off in the long run.
When doctors deal with symptoms and they're not sure what's causing the symptom, there's a process that goes on.
Yeah.
They run tests and blood work. If you are a mystery, they'll meet with colleagues and they'll talk to colleagues. They'll talk with other doctors and collaborate and try and figure out what's happening. They have these groups of people. If you're in the hospital, there are these boards, these committees where they'll meet to decide together what's happening here, what's the best approach. Yeah. And maybe one of the problems why we aim right for the symptom and not what the underlying issue is because we work in such silos and we're used to our silos. Yes. Parenting has its own silo, right? Parenting is kind of a lonely job.
Yeah.
Nobody is raising those children but you. So that's whoever's raising children, that's kind of a lonely job. You don't know the children. No one else knows them like you do. In an early childhood setting, we are very much sort of siloed and unaware of what's happening. There can be trust issues among adults where they think if I go to somebody else on this staff and say, what should I do? They're going to think I don't know what I'm doing, particularly people who are newer to it, I would bet. They're going to think I don't know what I'm doing if I go to get advice. I don't want to be vulnerable like that. We don't tend to get groups and committees together to talk about these things. A teacher goes to a principal or a director, right? They go to their administrator and they say, here's what's happening. And the administrator offers some wisdom and hopefully that'll work. And maybe it doesn't. Perhaps it would be far more effective to do what doctors do and to have a committee. This exists. I know there are behavior intervention committees in some schools. I don't think it's widely done enough. I think that we need these committees. When my father died many years ago of cancer, more than 20 years ago of cancer. And when they first were diagnosing him, they had a meeting of the tumor board. And the tumor board. It was the tumor board in the hospital, and he went to a doctor. The doctor said, I need to meet with the tumor board about this. The whole tumor board looked at whatever scans they had and results and decided together what the intervention would be. They decided what surgery would be, how that would go. It was an entire committee decision.
Yeah. And see, I feel like we need more of that in education. Because when you have a committee like that, so in this case, your father had a group of doctors and they probably had all little different disciplines or different manners of philosophy maybe or whatever. And all of that came together. It wasn't just one doctor saying, this is what I believe and he needs surgery. Or another doctor who might not believe in surgery saying, nope, I'm not going to do surgery. It's all comes together. And I think if we as teachers get together or educators, and you have this committee of like, okay, this person's an early childhood educator. This person is a psychiatrist. This person is, maybe a family engagement person. And you get them all together. They all have their things. And you compile a plan for what's best for the child with everyone's opinions. Because it's not just my opinion. I might think I know what the right thing to do is, but a counselor might have a different spin on what's best for that. And if you put them all together, now you have a plan of what's best for the child and how to get to the root cause of this problem, because I am not an expert in certain things, but other people might be, So, and I also think sometimes when you just go to one person, like when you go to your administrator, if you're going to your principal, say they might not know. I mean, that's where a committee is better. Like if that principal was on a committee with other people, now you can kind of get all of your experiences and education and expertises together and say, oh, here's what we should do and we can move forward. But you're right. Committees, there's not a lot of committees.
There's not.
You're on your own. You're, it's It's lonely.
And the truth is that we filter our thoughts and our opinions, our perceptions and our recommendations through our own mental lens. We have
Yes.
all had experiences that influence how we think. We have
Yes.
hidden biases. We have all sorts of
Yes.
things. So even in the position, I've been in the position of the program director, and people will come to me and say, what do you think I should do? And I would give some sort of strategy, right?
Right.
And I would say, try this strategy, try that strategy. But perhaps if there were a table of people where we could take especially the more challenging cases,
Yes.
that's what they do in medicine. If it's not such a challenging case, they don't gather the tumor board. It's when it's a challenging case, right?
Yeah.
So
Yeah.
if we have these more challenging situations where we feel like we ourselves can't come up with it, or what we come up with may be limited, perhaps we should gather a group of people. It doesn't even need to be a psychologist, and it could be a committee within your program. People who have worked with children,
even a group of teachers. Yeah. You know?
It can be a group of teachers who have different levels of experience, different experience with different children, a group of teachers who even have different educational levels, different amount of time they've been in the program. I would make it a very diverse group, not the same person over and over and over again. The same person over and over and over again is going to give you the same answer, but I want to get I want to get a really diverse group of people together and have them discuss and say, here's the situation. How do we think it should be approached? And let them come to some sort of group think decision. It's like a think tank.
Yeah, like a brainstorming kind of thing. Like, I don't feel like we do enough brainstorming. I don't feel like in some schools you do enough collaboration to begin with. Like, at least like in my case, when I go to work, I go in my classroom and I leave. There isn't even an opportunity for me to even walk into somebody else's classroom and say, hey, how you doing today? Oh, what can I help you with? You know, like there is no time, and that time isn't given to us to do that either in some schools. So like, and that's where I feel like you should, like, once a week, you know, say, hey, we're going to have a breakfast meeting. I'll bring bagels and you all get together and you can talk about, you know, what's going on in your classrooms. Cause maybe she's got more experience with this, or she can help you, or he can help you do this. And then even if it's on a casual basis, just getting to collaborate with people and discuss these things in a safe environment is not done in early childhood education. I don't think enough.
I think it should be, and I think it should be suggested.
Yeah, it should be.
And if we were to extend the metaphor, and you know, the medicine metaphor, when something goes wrong, they have meetings. They have big meetings where all the different doctors come in and review what was the case. If something goes wrong in surgery, if someone passes away, they meet. That's called I think it's called the M&M, right? That's the name of the meeting. I forget what it stands for. I'm not a doctor, but they have this meeting. All the doctors from the department get together. They review the case, they rip it apart, and they decide where was maybe the misstep, the error, what could we have done differently so that we don't do that again in the future. How many times have teachers had over and over and over again issues with the same sort of behavior? And we have to think about, is the way they're addressing it not working for anyone? And if it's not working for anyone, let's all sit together and think about it and look at it and decide what might work better in the future than the strategy that's being used. We only know what we know. We don't, when we sit together as a group like that, you learn more. You don't know what you don't know.
Exactly. And we should be learning from each other, you know, and using each other's expertise, you know, to help not only yourself, but your class and those children that need help, you know, so you could fill the need so that the behavior stops.
100%. I hope that this inspires people to think about two things. To think about the fact that the behavior you're seeing is simply a symptom, and that's where punishment went, folks. We have in 2022 the research and the studies that show that treating the symptom does not stop the root of the problem. We have to get to the root of the problem.
Yeah.
And when it's children's behavior, we have to fulfill the need that they're telling us they have. And the second thing to think about is to maybe talk about how wonderful it would be if there was more collaboration.
Yeah, it would be. Yeah.
When we're addressing something that's a little more difficult, like children's behavior.
Yeah. Yeah.
So I hope you all go back and think about that. I also hope that you all go and join the patrons on Patreon.
Yay.
Yes, there's extra content there. We release additional information there and resources there. And there are patrons enjoying it. So please go and consider it. It starts at only $5 a month. And we so appreciate that support, because we are hitting sort of the end of the end of the road. I can't even speak. End of the road of what we can continue to upgrade and offer. And we appreciate the support so that we can do more and more for everybody.
Yeah.
And maybe with everybody.
That would be nice. Yeah.
Right. We also want to make sure that you hang, because we have two places to recognize. I'm looking, if you're on YouTube, I'm looking over to my left because I have my notes. Okay. So in this episode, we have to, because of the tremendous numbers, we have to once again mention Canada, but we're going to get really specific about where, because there's one place where the majority of the numbers from Canada were listening to us over the past week or so, and that's Vancouver in British Columbia.
Nice. Hello, Vancouver.
So, hello, preschool peeps in Vancouver. Thank you so much for listening. Tell the people in another part of Canada. Do you know anybody in another part of Canada?
Yeah.
Reach out and tell them what to listen to us. Within the United States, we're going to shout out people who I think may know me, because I often provide professional development for this area. There's just one place, one location in this state where I often provide virtual professional development, where there seems to be tremendous numbers. And the state is Iowa. It's not, people are thinking it's where they live. It's not. It's never where we live.
No.
It's Iowa. And in particular, Charles City has been very high in our statistics. Hello, my peeps, my professional development listeners. Hi, everybody in Charles City, Iowa. Thank you. Yeah. Thank you for continuing to connect with me this way. And I hope to see you all on Zoom soon.
Yay.
And if you're not a Charles City, Iowa Zoom person, you should be. There's professional development being offered through your CCRNRs that I do. So keep a lookout for my name and look for that in the offerings that you get from your local CCRNRs. And if people right now are thinking, what's a CCRNR? It's a child care resource and referral agency. They're nationwide.
Yeah.
Okay, folks, we will catch you next time on the podcast. Have a good December.
Yeah. Bye, peeps.
Bye, peeps.